Hi, I'm Dr. Robert Herman. This video is the first in a series of short videos explaining how we are going to help you get rid of your pain. Now, Goofy here is trying to diagnose his patient, and that is very important. You have to have a diagnosis before you can treat your condition. What is generating the pain? Is it a muscle or a disc or perhaps a facet joint? That's what we are going to try to determine with a history and other diagnostic tests. So here we have some of the conditions that can cause back pain in males and females. Males on the left, females on the right. So on the male side we have ankylosing spondylitis, Paget's disease, prostate cancer, females, rheumatoid arthritis, osteoporosis. But all these conditions comprise only 2% of back pain. The other 98% is what's called mechanical back pain. And mechanical back pain, it comes from muscles, ligaments, joints, disc problems, and this comprises the vast majority of back pain, 98%. Estimates are that about 20% of back pain patients are chronic in nature. 80% of patients with back pain have an acute episode that resolves without residual pain. So if you're in this office, you are watching this video, you are probably in that 20% group where you had an episode of back pain, but it did not resolve. Maybe it did resolve and then it came back, and then it goes away, and then it comes back. And then it gets really strong, and then it goes away, and then it comes back. 80% of people, they have back pain and it goes away and they don't ever have any problem with it again. This slide explains what happens to that 20% group. If you look at the top, those patients will have a soft tissue injury or a disc injury or a muscle dysfunction, and that causes some low back pain. Now, the low back pain can resolve itself and just go away, or it can develop secondary dysfunctions, which causes either a joint dysfunction or a muscle dysfunction, which leads to more back pain. The secondary dysfunctions are what causes back pain to become chronic in nature. So let's explore what causes secondary dysfunctions. So back pain has the ability to change etiology or where it comes from over time due to the development of secondary dysfunctions. And your treatment can either inhibit or encourage this process of developing secondary dysfunctions. We do not want you to put heat on your injury. Heat brings blood into the area and that can increase inflammation. If you watch sports on TV, you can tell that they always put ice on there. You'll never see heat on the sideline. It is good to put ice on your injury because that brings blood away from the area and that will reduce inflammation. We do not want you to put a support on your back or your neck. We want you to get some light exercise and to move around a bit. It is much better to maintain normal activities if you can than to go to bed or just lay on the couch all day when you have an injury. We do not want you to take long-term anti-inflammatory medication like ibuprofen or Advil. Those can actually increase the development of disc degeneration. So what treatment you provide for yourself will increase or decrease the chance of developing secondary dysfunctions.